Hey guys, just a reminder, this is not official medical advice. For such, please seek an appointment with a licensed medical provider.
What's up, everybody? Welcome back to another episode of Explain This. I am typically your star, but today going to be the host of the show, Robin Riddle, and I'm joined today by Kristin Brogaard. She is the co-founder and chief scientific officer with Path Fertility. We are going to talk about a fabulous new test today called SpermQT. It's a new test that I'm using in my fertility world, and I've brought Ms. Kristin on today to tell us a little bit more about it. How are you doing,
Hey,
Kristin?
Robin. I'm doing great. Thanks for having me.
Absolutely. I'm so excited to get to talk more about this. So give me a little bit of background. Where did the whole idea for SpermQT come from?
Yeah, absolutely. So, as you mentioned, I am a co-founder of Path Fertility, and my partner and I, my co-founder and I, started Path Fertility about 6 years ago now, and really with the mission of raising the standard of care in male
Yeah.
reproductive health. We know that 1 in 6 couples suffer from infertility. And unfortunately, the primary burden, stigma, testing procedures all fall on the female partner's shoulders.
Absolutely.
Um, and it's what's amazing about that is 50% of infertility is due to the male. But for some reason, all of our technologies, all of our focus has been on the female partner when there is really a huge amount of effort that needs to be put in on the male side. And
Absolutely.
my background's in technology development, so I have a doctorate and a postdoctorate focused on technology development, and was really blown away when diving into the fertility space and finding that the standard of care for men is getting a semen sample and counting sperm under a microscope. So it's really fifth grade science that hasn't changed in 40 to 50 years of
Yeah.
counting and seeing how they swim. And that's the extent of what most couples are going through. And it's very, very, very well documented that the semen analysis, although it does add value, it really misses a lot of infertile men. So men are going undiagnosed. And when we were diving into the research and understanding this field, it was clear that when the man goes undiagnosed, the female partner is put through procedures that aren't going to work. And those procedures lead to increased time to pregnancy, increased emotional toll, increased dropout. And the fertility journey is already an excessively stressful journey. So it
Yeah.
is by men going undiagnosed, we really are adding to that. So my co-founder and I set out on the journey to apply some new technologies to the male space in order to make the journey just a little bit easier for the couple by diagnosing men earlier on.
That's awesome. So what exactly does SpermQT do? What are we looking at with this?
Yeah. So SpermQT, which stands for Sperm Quality Test, um, is an epigenetic test. And epigenetics is a very cool field. It's how your genes are expressed. And so you can imagine every cell in your body has the same hardware, has the same DNA sequence. So your brain cells, your liver cells, sperm cells, all have the same DNA. But it's epigenetics that really are important for turning the right genes on and the right genes off in those cell types in order for the cell type to actually work like a liver cell or a brain cell or a sperm cell. And what we had done now is understanding in sperm and during spermatogenesis, which genes are turned on and off, and how is that associated with fertility outcomes. And what we found over several years of research is that we identified a set of genes, it's 1,233 genes
Wow.
that are required for a sperm to really function properly. So they have to be properly controlled in order for a sperm to do its job. And sperm and male fertility is actually a very complex process, so you need really tightly controlled gene expression. And what we found after we identified this set of genes is we found that when men are having, or the couples are having trouble trying to conceive, we're finding that in these men, their genes don't look the same as infertile men, meaning they are not properly regulated. They're dysregulated. So the genes are not functioning properly, so the sperm is not able to find, bind, and penetrate the egg. So we're really identifying the molecular mechanism that's causing some male fertility issues. And what's really, really important is that we also found that men with normal semen parameters, so normal counts, normal motility, can have molecular issues, can have epigenetic issues that aren't captured. So this is leading to men going undiagnosed by not looking like what's going on inside the sperm. And what we identified specifically is that men with these issues, where these 1,233 genes aren't functioning properly, the likelihood of success with intrauterine insemination, or IUI, is really low.
Okay.
So if you have an abnormal sperm QT, the likelihood of success is statistically lower. And we're finding this now in looking at timed intercourse or natural conception. So it's really impeding the couple, to get pregnant. And it's part of those early fertility procedures, a year of timed intercourse, stimulated
Hmm.
intercourse, and then IUI. If we're missing men where this is not the right option for them, these couples are going through quite a bit of time and trying and emotional toll
And
that
money
not
and
going to work.
yeah,
And money,
all the things.
absolutely.
Yeah. And I always, that is, I find it frustrating in general in the fertility world that, like, oh, you're having trouble getting pregnant. The first thing we're going to do is an IUI and
Right.
medicate. Well, if the female is ovulating and the male's counts are normal, why are we thinking an IUI is the best option, anyways? Like, I know we're bypassing a few
Yep.
things, but it's so frustrating that that's just like standard. We're going to do 3 to 4 IUIs before we consider anything else. Like, I
Yeah.
love the
Yeah.
fact that this opens up that door of knowing, is this something that's even going to be helpful or successful? Like, let's
Yeah.
save that $5,000 or $6,000 you would have spent on all those IUIs and actually put it towards something that's going to be helpful versus wasting our time.
Absolutely.
Yeah.
Absolutely. We are finding in our data that couples who really get an early diagnosis of male fertility, they actually end up saving money,
Yeah.
and they spend obviously time, because you're bypassing those procedures that aren't going to work, and you're getting to a procedure that you ultimately will get to no matter what. So
Yeah.
it will save time and money for couples by getting an earlier diagnosis.
So, do you have any statistics? Is there like a certain number of men that you're seeing that have these issues?
Yeah, yeah. So we are seeing in the clinical samples we're receiving, it's about consistently 20% of men
Wow.
have an abnormal sperm QT. And what's shocking is the majority of them have normal semen parameters, meaning normal count and motility. So we are capturing a pretty significant subset of men that are going missed. They're kind of flying under the radar
Yeah.
in the fertility clinics. So we are with this test, even if you have a normal result, that could actually rule in like maybe IUI is the right procedure for you.
Yeah.
If you have an abnormal result, why are we wasting our time on a year of timed intercourse and multiple failed IUI cycles?
Yeah. So when we talk about normal sperm parameters, of course, like the WHO guidelines for normal now were like infertile, 20, 30 years ago. Like, it's
Right.
insane what normal is nowadays. Is there anything that you see in that analysis that could make you think they might have an abnormal, like a lower morphology or something like that?
Yeah, so right now we don't see a correlation between
Okay.
semen parameters and sperm QT, but what we do see is that men, the very subfertile men we're seeing, tends to have an accumulation of multiple male factors. So high DNA fragmentation, poor semen parameters, poor abnormal sperm QT. So we are seeing enrichment in these men who are struggling. They tend to be accumulating a lot of the factors that we associate with male fertility, but we don't see a correlation between an abnormal sperm QT result and a semen parameter.
Okay.
So doing that, a really important point is, so because we don't see that, doing the semen analysis with the sperm QT together is actually really important because you get a much more comprehensive view of sperm health. You can see, a guy with poor semen count and an abnormal sperm QT, the likelihood of success is the lowest for those
Yeah.
men. And then, but by having them together, you can actually really get very granular at understanding your odds for success with IUI, rather than being kind of blinded and a little bit of a shot in the dark with what the likelihood of success will be.
Okay. So with these men that are coming back with an abnormal, so in what I do, it's all about what can we fix. I'm not the one that's doing the IUIs or the IVF. I'm the one that's helping to support the natural pregnancies as much as we can, or get us as healthy as we can for the REs to help. So if you have someone that comes back with an abnormal from a provider standpoint, is there anything I can do about it? Is it modifiable?
Yeah. So I'm going to answer that with two ways.
Okay.
One is the coolest part about epigenetics is that it is influenced by the environment. We know, and so epigenetics you're not determined essentially by your DNA. It's really how you treat your body and treat your lifestyle that can change your gene expression. And we know for sure that um, lifestyle modifications impact sperm epigenetics.
Okay.
And we've now seen anecdotally in these clinical groups that men who make significant lifestyle modifications, and it's hard to pinpoint which one makes the most significant, but we're seeing, decreased alcohol consumption, increased organic diet, decreased THC, decreased smoking. All of those we have now had multiple anecdotal cases where a gentleman goes from an abnormal result to a normal over, 3 to 6 months after a full spermatogenesis cycle. So we are really excited about the potential that this can be modified with with your lifestyle. And I know that is something I'm just so impressed with what you do, and it's so important because fertility is very, very linked to how you treat your body and how you treat your lifestyle.
Absolutely.
And we definitely seen that with semen parameters, and we're now seeing that with sperm QT. In the cases where there is not either the time or the motivation for lifestyle modifications, we do see that the procedure called IVF with ICSI, so when you take a single sperm and inject it to the egg, that
Yeah.
actually overcomes the sperm quality issues we observe.
Okay.
So in the cases of looking for specific procedures that can overcome this, we do see in our data very consistently that ICSI, which is the standard of care when there is a male factor, actually does overcome it. We don't see any differences in miscarriage rates or live birth or anything like that. So there's really two options there. I think lifestyle, obviously, it doesn't hurt to just get healthier in general. That's going to make everything about having a kid easier.
Yeah,
But
absolutely.
yeah, there's never a downside to that. But if there is just a discussion about which procedure to move to, we do see that ICSI overcomes the quality issues in sperm QT.
Awesome. So for getting the test done, of course, patients can go through a provider. Are you guys set up with a lot of fertility clinics? Like, is this getting more popular in the clinics now?
Yeah, absolutely. So we are now utilized throughout the U.S., where the standard process is a fertility physician orders sperm QT for their patients, and we are associated with fertility providers, and there's really two methods for collection in that case. You need a semen sample. You can provide a sample in the clinic, either when you're doing your standard semen analysis, or you come in and they'll ship us the semen sample. Or we have an at-home collection option where the physician says, please ship this gentleman a kit. We send out a kit directly to the patient's home. There's prepaid shipping. It's very, very simple collection. And then it's shipped directly back to our lab. We do have the option if you're not working with a physician or your physician isn't really educated on sperm QT, where you can order online. So
Okay.
if you go to pathfertility.com, you can order the sperm QT, and we have physicians on our end that will sign the order and provide a consultation for the patients. So it's
Awesome. Okay.
very simple to order online. We can ship a kit to your house. and then provide results back with the consultation.
That's awesome. So if a patient has never had a semen analysis, you do have a kit that will do that as well as the
Yes.
SpermQT, correct? Okay.
Yeah, thank you for mentioning that. So it is really important to get a comprehensive sense of your fertility potential. And just doing one test doesn't get you there. So doing the semen analysis with SpermQT is really important. And like you mentioned, if you haven't had a semen analysis or your physician hasn't ordered one yet for you, we have the option of an at-home collection kit
Okay.
that provides both the semen analysis and SpermQT. And those results are a very comprehensive semen analysis is provided back.
So how does that, your semen analysis, how does that compare to ones that would be done in a reproductive endocrinologist clinic or a fertility doctor's
Very,
clinic?
very similar. It's actually
Okay.
done by an andrology lab, which is labs that do semen analyses in a hospital clinic. So it is the same output that you would get from a fertility, and maybe even a little bit more comprehensive, but in most cases it's very similar to what you would get in a fertility setting.
Awesome. So as long as patients follow the instructions and collect and send
Yes.
appropriately, then we're going to get pretty good results out of that, right?
That's exactly right. That's
Okay.
exactly right. And if there's any issue, we contact the patient and let them know if we would need a recollection, but that doesn't happen very often.
Okay. Okay. So when in the fertility journey, in your opinion, should people think about doing a sperm QT?
Yeah, I am of the opinion that more information earlier on is better in most cases with health. And
Absolutely.
specifically for fertility, because um, the male side is very important for determining the treatment path. It's really important to understand that as early as possible.
Yeah.
We have some patients ordering online when they're just thinking about trying to conceive to see if this will at all be an issue. So very early on. But if you have gone down the path and you've tried for 12 months at home, I think it's time to really dive into get the male fully checked up, and that would be a semen analysis and sperm QT. So I
Awesome.
really think anyone who's considering getting pregnant, who is in the fertility journey, who's considering IUI, the earlier the better to order this test and to get the male worked up. It is very important.
I agree. So, we talk all the time whenever we're talking to men, like we've said, things are modifiable, but it does take time.
Yes.
So that one spermatogenesis cycle is a good 3 months. And when you've been trying and then you find out like, great, like this is not working. And now I've got 3 to 6 months to make these changes before anything's going to be working. Like it's very frustrating. So I do agree. Early testing is
Yeah.
fantastic. Get ahead of things. I love the idea of even if you're not even trying yet, like just figure out
Yeah.
what's going on. I was watching a video the other day, a podcast where they were talking about how much the male actually contributes to the pregnancy. Like you just think like, oh, I do my part and I'm done. Like things are good. They're finding now like pregnancy induced hypertension, hyperemesis, like gestational diabetes. All these things are coming from the male side of the genetics. So if we're not
Absolutely.
contributing great genetics, we're not going to be set up for the best pregnancy. So,
That's absolutely correct. And it's really been it's game changing over the last decade or so, elucidating the biology of sperm and male fertility because, like you said, it is very linked to every single step of of pregnancy and even
yeah.
delivery. Sperm carry RNA and proteins in the head of the sperm that are created during spermatogenesis that gets put into the egg that is crucial for proper implantation and development. So making sure sperm is as healthy as possible, just like women are doing when they're, right before they're trying to conceive.
Yeah.
Really optimizing male health is extremely important for the health of the pregnancy.
Well, I love it. And I'm so glad that you guys developed this test because I think this is really going to be huge for the fertility world. I have so many patients already I'm recommending it to. So I'm so
Wonderful.
excited about it. I think it's phenomenal.
Well, thank you so much, and thank you for what you're doing. Starting with early on lifestyle modifications to make individuals as healthy as possible.
Yeah.
It's going to be it's really important. So, and I appreciate your support. elucidating the role of the male in the fertility process.
Hey, it's a 50-50 gig. Like, they need to quit slacking off. They need to be on top of this too.
Absolutely.
Well, thank you so much, Kristin. Anything else you want to put out there for SpermQT?
I would just recommend learning more. Go to pathfertility.com or just Google SpermQT and feel free to, there's a direct email in that webpage, so feel free to ask any questions. But yeah, looking forward to tracking you, and thanks for the opportunity to be on your podcast.
Awesome. Thanks for being here. Guys, that wraps up another episode of Explain This. We'll see you guys next time.
Don't go away.